Good morning, brothers and sisters. Today we continue on our theme of Health Month, and we have as our presenter this morning Dr. Stevens, who will address the issue of breast cancer. Welcome, Dr. Stevens. Good to have you.
Good morning, brothers and sisters in Christ. It is indeed a privilege and pleasure to be here once more. And I will not be speaking on spiritual health today, but on your physical health. And what I intend to do is to give you some information that hopefully will start to stimulate your thinking, to internalize and to see how you will be able to help others in the church, in your family, as well as in your community. The theme for this year's breast cancer awareness is that no one should face breast cancer alone. It means that we need to support persons who come down with this disease condition. Okay, next slide, please. I'm going to run through some slides, but I will just stay a bit on the ones that I want you to focus on. Because unlike other areas, I'm going to tell you what is happening in Jamaica. I have been very privileged to sit on certain committees and to have the information. Next slide, please. That reminds you of the anatomy of the breast. It is a mammary gland. It secretes milk, right? And it has what we call lobules, which is connected to the nipple by ducts. The majority of cancer, next slide please, will occur within the ductal system. And so we find out on the international stage that breast cancer is very common. However, less women died of breast cancer in developed countries compared to Jamaica. Also, the stages at which they get breast cancer is usually earlier, right? And there is a decreased mortality with respect to breast cancer in developed countries. Later on, we'll find out why in Jamaica we are having so much breast cancer and why the deaths are occurring. Next slide, please. When we look at the local situation, and I want you to look at that slide, we find out that it is the most common cancer occurring in women in Jamaica. In 2018, 974 new cases. We had 974 new cases and 413 deaths. It means 1 out of every 15 women living in Jamaica, by the time you reach 70, you might come down with breast cancer. Persons sitting in the church today, if you should go through everybody, you will find at least one person with breast cancer. And by some of us reach the age of 70, 75, some of us will come down with breast cancer. Next slide. We're having some technical difficulties, but I have my backup. Global Scan Observatory did a more recent update. And in 2020, 1,200 new cases of breast cancer, and 637 persons died. Notice in 2018, it was 974. And in a 2-year period, right, we have almost 300 more cases, which is very alarming. What is happening also is that 60% of these cancers in Jamaica are occurring in women under the age of 60. Women in their reproductive working life, okay? While in developed countries, it's usually over the age of 60 when they are more near to retirement. In Jamaica, we are seeing more younger women, earlier age of diagnosis, and the tumor grade is very high. Means it's more significant to end up with mortality. The tumors tend to be more aggressive and of advanced stages. Now, that shows from 2010 to 2018, it moves from 43 per 100,000 women in the population to 56, right? So something is happening in our environment, okay? Which is causing that to happen. Next, please. The other thing I want you to remember is that breast cancer is not a transmissible or infectious disease. You do not have to be afraid of the person with it. There are a lot of stigmatization surrounding it, and persons having come down with breast cancer tends not to talk so much about it, not to let other persons know about it. But it's important that the people around you know, because you're going to need the support. You're going to need the support when it comes to diagnosis, support when it comes to treatment and aftercare. Next slide, please. We're having technical difficulties. And other thing I want you to remember is there are risk factors that allow one set of women to be more likely to come down with breast cancer than the other. But when you look at these factors, which most are modifiable factors, if we should control for them, is only a mere 30% of women, you will see a change in mortality. The most important factor that you need to remember is being a woman, right? Being a woman and being over 40. So, don't lull yourself into a sense of false security to say that you will not get it because you don't have a family history. You are not fat because I exercise a lot, I don't drink alcohol, I don't take hormones. When you look at those factors, the most important factors is that being a woman and being over the age of 40. Okay, next slide, please. All right, so how do we get the incidence down? All right, how do we get it down? We need to have a system. I want to say this up front. Jamaica does not have a comprehensive breast cancer program. What we have policies relating to the screening, the diagnosis, and treatment of breast cancer, right? And one of these is to encourage women to become breast aware. How early you should become breast aware? Most people would say as soon as you start seeing your menses, but then another group saying the majority of these young girls will not develop breast cancer. So let us start at, like, say, age 18, age 20, right? Get familiar with what your breast feels like, right? What it looks like. And today we are going to, the young people in the congregation, we are going to teach them how to look at their breasts and how to examine the breast. So that is one option, because in 90% of the cases, it's the woman who will feel a lump in the breast and seek care. Next one, please. The other one is what is on the board there, which is clinical breast examination. As part of your Well Woman Clinic visit, and some persons say, because the incidence of breast cancer in Jamaica is rapid, we should begin at age 30, but international consensus, we begin at age 40. And when you go for your annual visit, you should also ask the doctor or the nurse or the midwife to do an annual breast examination. Next slide, please. But the gold standard to screen, right, is the mammogram. The Jamaican standard is we start at age 40 and we finish doing mammogram every year until we are age 74. The WHO requires us to begin at age 50, right? Because when you do the risk-benefit analysis, 50 is the cutoff point for most countries. However, because we are seeing younger and younger persons coming down with breast cancer, we suggest age 40. And some people even want to push it below that. Next slide. This, as I said, is a gold standard. It is very safe. It's low-dose X-rays, right? It has a sensitivity of about 86%. And it simply means that it will pick up most of the cancers at a very early stage, even when the cancer is like less than a peanut, less than the size of a dot of a pencil, it will pick it up. And if it picks it up at that stage, then your chance of surviving is like 99%, and your chance of getting radical treatment, such as removing your breast or chemo and radiation, is significantly less. However, what we find happening is that Jamaicans are not availing themselves to have mammograms done. A survey done by the Ministry of Health published in 2018 under the Jamaica Healthy Lifestyle Survey, number 3, shows that only 6% of the population had annual mammogram in the preceding year. 6%. For us to control breast cancer, we need to have at least 70% of the women in the age group that breast cancer occur getting mammogram. A recent study coming out of Kingston Public Hospital, and I'll mention about that later, with patients turning up with cancer of the breast, shows that only 23% of them had prior screening within the last 5 years. And when we look on other breast issues and so on, we realize that the average interval between presentation and having a mammogram is 8 years. Not annually or every 2 years, okay? we need to close the gap. Next slide, please. And we need to close the gap by ensuring that persons will do their annual mammograms. But here is also another problem we have in Jamaica. In 2018, I did a study. I looked at, across the island, how many mammogram machines we have there. And it was only 21. And if you look at how many we should have across the island, it will be about 63, 65. Parishes like Portland, St. Mary, Hanover. And at the time of the study, Clarendon, a big parish like Clarendon, didn't have, but now they have. Kingston didn't have. St. Andrew had 7. Yes, Dr. Nelson, Kingston didn't have because there was none at Kingston Public Hospital, which we have been advocating for more than 20 years. But in September 2023, Kingston Public Hospital now has a mammogram machine, okay? They don't want me to announce it too much, because they don't want to run on it, okay? Because we don't have enough, okay, a lot of persons have to wait a long time to get these things done in the rural areas. Okay, Kingston, not so much. And we're going to go through a lot of the other slides now, because what I have devised for you, and you can call Women's Health Network, and we'll just give it to you once you have a lump. And we are working also with KPH, because some 5 years ago, we came up with the idea that we should now have dedicated clinic for just breast cancer. I had a little tussle, right, to get the name of the clinic as Breast Health Clinic. But the doctors prevailed upon me, and it's now called Breast Oncology Clinic. So at KPH, there is a breast oncology clinic going on for the last 2 years, where if you feel a lump or you're diagnosed, rather than going through a regular clinic situation, you go directly to that clinic. You have expertise there, right? One of the doctors has been trained at Roswell Park Breast Cancer Center in the States, right? So the latest treatment, you will get it there, right? Because what used to happen is by the time you get the biopsy done, right, and by the time that they send you to the clinic, to a clinic at KPH, and by the time you wait to see the clinic, to access the clinic, right, your cancer starts to move beyond your breast. And we don't want that to happen. We also started with Mapen Hospital, but unfortunately, we were not successful. But our hope at Women's Health Network is to ensure that in every region, there will be a dedicated clinic for women with breast cancer, where there are expertise available and there are equipment available, right, such as mammogram and ultrasound, which can expedite these things. The next set of slides shows the care pathway. A lot of the times when women are diagnosed, it's a very difficult diagnosis. Your mind went gone all over the place. You turn foolish. You run from pillar to post. We have created a care pathway. So what the healthcare professional can follow, what you and your family can follow. If you are under 30, if you are 30 and above, and you feel something, what's the next step? At the end of the church, We have pamphlets over in the church hall you can get to educate. And I'm giving you some fans. It's not only to fan, but there are also a snippet of the care pathway on it that you can keep at your home and make sure that all women and the men, sorry, I've been talking about women, but men do get breast cancer, less than 1%. And the sad thing about it, when men get breast cancer, they don't live as long as women, okay? So it goes also to the men that you must feel up your titty every month, all right? Okay, we're going to go very rapidly now because I'm going to invite a breast cancer survivor, and I told you something about what is happening in Jamaica, and the survivor is a Jamaican but got treatment overseas. And so she can share with you, how her treatment, what she did, and so on, and how she received support. And we can reflect on the way forward in Jamaica. Remember also, we do not have a lot of money to do a lot of things, okay? But if we advocate for more resources, I am certain we will be able to do better. Over the last 2 weeks, reports have come out also that there might be a vaccine for breast cancer on the horizon. That will radically change a lot of things. Because just like cervical cancer, where there is a human papilloma virus, if we can vaccinate young girls, right, and men against this terrible disease, then we will be able to save more lives. Also, we have to look at some of the things that are holding us back, some of the barriers to screening, and I mentioned some earlier. But we lack a universal public health screening with respect to breast cancer. And I think it's not that we can't do it, but the political will is there, and we do not have women advocating enough, all right? The other barrier is the unavailability of mammogram equipment throughout the island, and the cost of the mammogram, which averages about $7,000. And if you have to do a 3D mammogram, it can run you up to $26,000. A lot of poor people cannot afford that. There's also the other issues of the perception of pain that the patient will feel. But it depends on the size of the breast. It depends also on the time of the month, and it also depends on how careful the radiographer is doing it. There are also treatment barriers. Even when we get diagnosed, okay, we are not getting our treatment in a timely manner. The results are not coming back to us in a timely manner. Sometimes 6 months, sometimes a year after biopsy, a woman is getting back her result, okay? In an ideal situation, you do the biopsy, insist on 1 to 2 weeks to get back your result, especially if you're paying for it, okay? And a lack of a comprehensive cancer treatment center is also one of the barriers. The government has a policy of converting St. Joseph Hospital into this cancer treatment center. And so far, you have the radiation arm is there. What is needed is to remove the old radiation arm from KPH and put it to St. Joseph's, as well as the operating theater there, fix it up for surgical oncology and other areas for medical oncology. So, because once you have the operation to be done at KPH, you're going to compete with the gunmen. Somebody's going to come with a gunshot wound and bleeding, right? And you are scheduled for an elective case, and they're going to move that person into the operating theater. And so your mastectomy get canceled, get put off, and keep getting put off, and so on. It used to happen to the gynae cases also, and one day I got vexed, went to the clinic and took up the things and put them on my head and walked over to Jubilee with them and said, we are not coming back here, right? And so we now have the gynae services at Jubilee some years now. We must also be cognizant of the consequences of this diagnosis, the stigmatization, the psychosocial issues that comes up, the marital separation, right, and divorce. More men tend to leave because they cannot deal with the body dysmorphic features of the woman. Okay? The financial burden and the interruption of social and working life. However, we are not sitting idly by. As I told you before, through our influence, we establish dedicated breast oncology clinic it starts at KPH, but we would like that to be done in all the regions. We continue to conduct situational survey to see what is happening to women with breast cancer and receiving these treatments. We have designed care pathway, but the most important thing that we have done that I want you to remember, and I'm giving it to the church, is that we have designed a course. We call it a breast health communicator course, where we are going to teach you how to interface and interact with women who have breast issues within the church. So I want at least 2 of you to be trained, and it is free and it is virtual, and we're going to begin in February. We started during the pandemic, but nobody took it up. So we're going to advertise again for February. And at the end of it, you will get a certificate, and you will get a pin like this, right, for you to walk around to say you're a breast health communicator. Do you want to know anything about the breast? Ask me. Okay? What we want to do, we want to provide mobile mammograms to underserved community and continue to advocate for specialist care as well as advocate for equipment, right? How can you help as a church? Become trained as a breast health awareness communicator, and tell people about us, tell them what we have been doing, and tell them how they can help us. I will now invite Mrs. Stevenson to come up, and I gave her a limit. She has just 4 to 5 minutes.
Just 4.
4 minutes.
It's so much.
Right? And she is going to put a face to some of the things that I have been saying. I thank you.
Good morning, church.
Good morning.
Just want to say thanks be to God for allowing me to be here, and I could just share quickly. It's going to be really quickly. And I just want to thank Dr. Stevens for the wonderful presentation that he did. It's really very, very important for screening. My breast cancer was diagnosed at a very early stage because I was fortunate, I'd call it, to have had a lump in my right breast. So I was on constant monitoring. And on one of my screenings, they identified that there was something that needed to be biopsied. I did the mammogram on the Monday, and by the Wednesday I had a biopsy. And I was told that I needed surgery. But there was another challenge happening in my life, so I had to sort of wait until I was able to go to surgery. It turned out I was able to go to surgery at the beginning of the pandemic when everything was basically closed. But because of the importance of cancer and how quickly it could spread, I had the surgery done. And it worked out well for me. I didn't have to, because of early diagnosis, I didn't have to get radiation or chemotherapy. All I have to do now is be on medication for like 10 years and go back every 6 months for screening. So please, examine your breast. I couldn't feel mine. It was so small. It was like grain of sand, they told me. But, examine your breast, and if possible, try to get a mammogram, possibly once a year. I know it's difficult in Jamaica, but now that we know that KPH has the machine, try to get an appointment there. All right? And I just hope that you never come down with this dreaded disease, because I've lost a couple of friends. So it's real. Everything that Dr. Stevens said is real, but early diagnosis is really the key to survival. Thank you very much. Have a good day.
Thank you. Dr. Stevens, don't go yet. I'll entertain about 2 questions. I know it's important. If you have a question to ask, please do so now. As a church, we are made up of course, 90% women, and so it's important for us to allow them to gain as much knowledge as possible and to share their own stories. You have a question, Alstead? Okay, go ahead. It's a microphone. It's coming. It's interesting that man is asking the first question. He has a wife, you see.
This one is for me. Dr. Stevens, I am cognizant of the fact that men do develop breast cancer. The symptoms, because less than 1%, few men is going to check. Are the symptoms the same?
Are the symptoms the same? What are the symptoms in men who develop breast cancer? What are the symptoms for men?
It's the same symptoms like women, right? And we had a presentation that would show it, but technical difficulties. But if you take one of the fans, right, you will see it on the fans. And when you come over there, we have display, and we have pamphlets to give you, and it's all there. And we have, actually, there is a photograph of a man in the presentation pointing to his scar, right? But the lump, the difficulty, the eczemas, the rash, the thickening, and so on, just like in a woman. Okay?
Thank you.
Yeah.
Sir, is there a difference between the incidence of women who have breast cancer, those who have had children and have breastfed, and those who don't have children? Is there an incidence in the increase in the incidence of breast cancer among those two groups of women?
Okay, the simple answer is yes. But remember what I told you earlier, that when you consider all of those differences, it does not translate into survival. The most important difference is being a woman and 40 years and over. All the modifiable factors, such as the duration that you have been exposed to estrogen, right? Early menarche, started to see a period early, and late menopause, and so on, right? When you put everything together, right? The only two, even this dense breast, right? Only two important factors, being a woman and being age 40 and over.
Thank you. One more final question. Is there a final question? Thank you, Dr. Stevens, and thanks to, I didn't get her name. What's your name? Stevens. Well, thank you very much for your testimony. Thanks.